think there are several different solutions to these issues that are coming up again and again when it comes to patients' usage of AI. With the growing reliance on AI tools, patients are grappling with rising costs, access to challenges, administrative complexity. All these things are just driving patients to using artificial intelligence. And so I think that AI is helping patients with these rising costs. And if you want to know how that is, we did a whole video on how AI can help fight denials. You can watch it right here. But this AI tools are really powerful and that can help patients with that. So I would encourage you to understand the tools and how patients are using it and guide them on ways they can fight denials if they're getting it or help with prioritization, because that ultimately will help your patients who are doing it on their own anyway. But more importantly, that creates that stickiness that gets you closer aligned to them. Second, patients have demanded for information when provider offices are closed. That's so key because access is so huge. If you have a pain, you need help with it now, then you want to get answers now. And a lot of clinics and offices are closed after 5 p.m. But now you can stay open anytime. Embrace those AI tools that answer calls after hours that not only are just phone trees and to leave a message, but actually has a FAQ, frequently asked question database, that's feeding into. So questions that patients call after hours, they can get answers to them, right? And then tie that in back to you, and maybe you can help them right then and there. People want fast answers when they're in pain. Now, here's another tip. If you live in hospital deserts, locations more than 30 minutes of drive from general medical or children's hospital, is so very important to find a way to connect with these patients because they're looking for help. And matter of fact, in the study, ChatGPT said that they found that there was a lot of patients asking for help that were in these hospital deserts. One tool we found that can help is remote care as a service programs that provide blood pressure monitoring, glucose monitoring, and connectivity back to a clinician at a timely manner is super helpful in making sure those patients who live outside or in those hospital deserts get more connected to their patients. If this is something of interest to you with this kind of remote care as a service type program, look, we have an offer. So go check it out and link below if you think it can help you, your patients, so they still feel connected to you, even if you're not around. The fix isn't more automation. It's keeping patients engaged with a human in the loop. That's exactly what we built for. As a matter of fact, that human to human connection is so important to us here at SynsorMed that we created a new AI tool called Simon. It's about getting patients engaged in their own care while keeping the human in the loop. A reward-based system that gets them taking their meds, checking their blood pressure, and staying active, all in a point system with leaderboards to keep them excited about their healthcare journey. It really keeps the patient and the human in the middle, but uses AI to track everything and encourage patients along the way. Hey, if you want to see it, if it fits your organization, put the link below, check it out, and give us a call if it makes sense.